Hi, I'm Jonathan Mayo, and this is Cleaning Closets Panels on Air. And today's discussion is, what role does health play in the coming out process? I have a special guest with me today, Christine Head. She and I know each other from, well, my boyfriend has worked with Christine with the Illinois Safe Schools Alliance, and I know you went to Bryn Mawr College, where you went, and you also worked in the, let me make sure I get this right, the Intercultural Affairs Office, where they did issues on race, class, sexual orientation, and gender identity. And then you've also done work with Cook County and some other organizations. So thank you, Christine, for joining us today.
Thank you, Jonathan, for inviting me. I'm really excited to talk about these topics.
Yeah, me too, especially because I don't think that people always realize that health does play a role in coming out, because we have to be aware of our own health. And I think especially in the LGBTQ plus community, there are a lot of issues that we have to think about. Now, I think a lot of times when people think of LGBT health, they automatically think HIV and AIDS. Do you think now, in this time, in 2015, that is still a big priority we should be thinking about?
Right. This definitely should be a priority, but it's not the only priority. We, for the past few decades, we've been openly talking about gender identity and sexuality in relation to health. We've definitely had a huge focus on HIV and AIDS. And then now we're sort of expanding to other issues of sexual health. But there are so many other aspects of health that people who are LGBTQ are facing disproportionately in comparison to their straight peers that we don't really talk about, because we do have this fixation on sexual health. And part of that is our own, societal issues with talking about gender identity and sexuality, but the other part is the money. Really, most things that have to do, especially with young people and adolescent health, we're really talking about sexual health, and that's where the money is. So people don't really even have the capacity to look at other things. But because LGBTQ people are disproportionately facing barriers in terms of finding stable employment, because our labor laws that protect LGBTQ people are not really there consistent. Policies and practices around finding housing are not really stable and or consistent across state or county. So those things that definitely impact health that we will talk about a little bit in terms of class and race. We don't really look at that intersection of, class, race, and gender identity, sexuality, and how, yes, we can talk about HIV, but those same people who are vulnerable to HIV because they don't have access to preventative services are also the same people who probably are not able to go to the dentist all the time or go get an eye checkup all the time. And so really, there does need to be a push around what holistic health means and how we can still talk about sex in general, but especially identity, without forgetting the fact that people are going to need glasses too. People are going to need diabetes testing and all these other things that we talk about around medical resources that we generally leave LGBTQ people out of.
Okay, so you're saying that, yes, of course, HIV and AIDS is something, but almost like any health reason, any health issue, even dental, these are all things that our straight counterparts are always, talking about and able to receive because of their class or their privilege. And it's so interesting. I never even thought of, like housing instability and things like that, how those obviously impact the health requirements that we're fulfilling. So that's very interesting to think of it that way. So what would you say then are some of the disparities in the community?
Right. So a lot of those things really revolve around access to health insurance.
Okay.
And really access to jobs. So
see, and that's something else I found interesting that you said earlier too. I never even thought about the access of jobs and how that does impact our health insurance. Now, of course, we have Obamacare and now stuff like that now, but there's still a lot of times you get that better health insurance with a better job. So I never even thought of that. So yeah, sorry, keep going about that.
Oh no, the job issue is like one of those things that, I mean, I think I'm lucky to have been able to think about it because I worked at a labor union for a while. But it's definitely one of those things that if there was something that we should focus on, now that we have the marriage victory, labor laws should definitely be one of them because some states do have laws that protect people, but they're not really done consistently, and people are still afraid, even if you live in a state that has them, then it can be hard to actually get the practice done because you don't want to lose the case and be stuck with this employer. So theoretically, Illinois has laws that protect you, but even looking at places like ACLU versus Lambda Legal, they kind of disagree even on whether or not we in the state of Illinois are completely protected by those laws in terms of gender identity, sexuality. So if you can't really pay for those things, if you can't pay for stable housing to, have your treatment done, then of course you're going to be less healthy.
Right. Yeah. And I recently, the HRC Corporate Equality Index came out not too long ago. And I found it very interesting. And I don't have those stats top of my head. I didn't even think to have those ready for today. But it was very interesting the amount of corporations that actually had identity in their policies, because
Right.
many places don't. Statistically, it was very disheartening to know how many did not have identity in their, like, sexual identity and gender identity in their policies.
Yeah, and it's definitely something we need to think about, but it's also one of those things where, our focus just has been somewhere different and disproportionately so. Our advocates are honestly in well paid positions where they're pretty protected by educational privilege or class privilege. But if you're someone, say, who is like a recently out trans woman in Inglewood trying to get a job at McDonald's, then the situation is going to be completely different because maybe you don't have the money to pass as well. Maybe you don't have the money to go through an entire litigation process with McDonald's as well. So that
Mhm.
person will still be fired, but honestly, no one will probably ever know about it.
Ah, yes, right. That makes sense. Okay. Well, and so what are some of the other issues then a trans woman or a trans man might have in regards to their health?
Right. So there has been a little bit more work done around. We still have a long way to go, but there's been some definite at least forward progress in regards to trans health. There have definitely been a lot more changes in terms of moving away from people having to have lived experience in their gender identity before they begin gender affirming procedures or anything like that. Now, like at Howard Brown, all you need is informed consent, which is a big deal.
Mm,
Um, and
okay.
definitely addresses some of those safety issues that people talk about in terms of starting your transition and not really, passing per se and scare quotes and what that means for people in certain places. But there still definitely needs to be a lot more training around what to do. How do we talk about people's bodies in a way that's safe? How is it that we make sure that we care for the entire body? So thinking about things like how is it that we talk about pap smears for people who have vaginas and may not be comfortable talking about those areas are still things that we need to talk about.
Mm,
And we, again, are still very focused when we think about trans health on HIV. A lot of the work, a lot of the big push has been around HIV prevention, but not so much in terms of making sure that people are healthy and safe
mm.
and feel comfortable with their physician. So people need to be trained a lot more than they are.
And I think you're right about the sensitivity training needs to be there as well, because how do you discuss these things with your doctor? It's so important to have the right doctor. And could you talk to me maybe more about, what are the kinds of things that people should look for when they're looking for the right doctor, or what kind of things make people uncomfortable when they're with their doctor in that sense? If you know what I'm saying? Like, why is it so important to have the right doctor?
I think having the right doctor is critically important, but it's one of those things that describing that process is really hard and
Mm.
it's so personal because, again, because of the intersectionality issue, because we don't necessarily, you have to know what you're looking for and what's going to help you. Like if you want um, a physician who's a person of color and who recognizes those intersectionality issues that you want to address, then I think it would be good to find place. There are doctors in Cook County even that do that. Like I think the adolescent health department, if it will still exist in the next year, has done a really good job providing a space that is culturally competent around sexual orientation, gender identity issues, but also looking at those issues of race and class. Um, but again, it's not, they're a good example of somewhere that does a really good job of addressing those issues, but they're not the usual suspects. They're not necessarily practicing in Boys Town or, it's not like a nice shiny building. I mean, it's county hospital. So I think that just like finding any other primary care provider, it's about really knowing what your needs are
Mm.
and understanding that it's perfectly okay to break up with your doctor. If your doctor makes you uncomfortable, then fire them, get a new doctor. You're not stuck with this person for the rest of your life.
Right, exactly. And I think it took me a while even to realize that, because it wasn't until I moved to Chicago that I really found a doctor that I liked, and someone who is familiar with, health issues that might affect a gay man. And I was like, oh my gosh, and I feel comfortable talking to you. So there are things that I think some of us take for granted at times.
Right.
Yeah.
I still haven't really found like my perfect doctor even, and I know that it just takes a really, really long time, but it's also we have to really make it so that people feel like they're partners in their care, that they're not they're not just the people receiving instruction. So I think also part of it is a cultural shift within medicine to understand that you are providing a service, and that you do need to be open to respecting your patients and their needs and understanding that they're experts in what their lives and whether or not they'll be able to do this treatment or whether or not their body has changed from the last time they saw you or not.
Right. And I think, speaking of a cultural shift within the medical field, I think we're reaching quite a few shifts recently. I mean, earlier this year, Illinois banned conversion therapy for young adults, and then the pill that's helping with HIV medication, it's apparently was just bought by an ex-hedge funder and went from $13.50 for a pill to over $750 for a pill. And then there's now PrEP, which is, the pre-exposure prophylactics for preventing HIV. And then there's all this stigma around that now. So we've made quite a bit of cultural shift. Now, do you think this is for the good or for the bad, some of these things?
Well, there's definitely some awesome things. Like I think people talking about PrEP is amazing. I think the conversion therapy is like a huge, huge win.
Mm-hmm. Because I think a lot of times we don't think about mental health as health. And that's in any community. I think people forget it's so important to stay healthy mentally. And conversion therapy obviously has been proven to have a negative effect on your mental health.
Right. And what makes mental health so hard in terms of talking about it in relation to gender identity and sexuality is that there is so much stigma already around mental health issues, and things like historically being seen as a mental illness to not be straight, I think makes people really hesitant to talk about mental health.
Mm-hmm. Right. Right. I think you're right. So then how early in someone's life, especially in the LGBT community, how young should these people start thinking about some of these issues?
Right. But I think for people in general, we should be thinking about our health a lot earlier. But I think that, it should be something that people start doing as we talk about our bodies when we're young. So once we're, in elementary school and we're starting to learn about what doctors do and that bananas are probably better to eat than cookies, and we should also be talking about, how does your body feel and what feels good and what doesn't feel good and what is something that makes you feel uncomfortable versus not feeling uncomfortable. And I think part of that conversation should be about talking about how you feel about yourself and how does that make you, are you uncomfortable with that? What do you want to explore about yourself? And I think that's a way to kind of bridge that conversation and connect it to health in a way that might, I think, generally make conversations about gender identity and sexuality easier, because generally when we talk about those things, we're talking about sex. We wait until puberty usually to talk about those things. But I think connecting it to just overall wellness and in tuneness with your body, I think would probably be healthier for everyone.
Yeah, I agree with you. And you're right. So much of it focuses around sexual health. And now, and Russell Love joined us last or 2 weeks ago for the conversation around how race impacts the coming out process. And we mentioned a little bit because he works with an organization that I used to work with him with this theater that is part of the Illinois Caucus for Adolescent Health, and it's called FYI, for Youth Inquiry, and it's all about sexual health and being sex positive. And I think sometimes people hear that and they're like, sex positive, what does that mean? It's not meaning that you're irresponsibly having all kinds of sex. It just means that you're having responsible, consensual, sex. And I think it's a very interesting movement that's making a lot of headway lately.
Yeah, sex positivity is like so important to talking about health, and especially for LGBTQ people, because our own baggage around sex, especially thinking about how providers interact with their patients, makes it so that it even coming out to your provider is really hard. I guess I'll just use me as an example, or examples of some of me and my friends. Like when we were in college, we went to a women's college, and we would always joke around about like the crazy questions gynecologists would ask. Like I had a friend who, she identified as queer. She was dating a woman, and the nurse there really didn't want to start her on birth control because she was like, well, you're a lesbian. Like, neither one of you are going to sprout a penis, so why do I have to even talk about birth control with you? So I think it's those, like, even meaning to be super progressive and like fun about it, or it's those moments that kind of make people shut down, and that's when your patients start lying to you, and you're going to end up missing so many huge things that impact people's health, all because you can't get over your own baggage. So I feel like physicians need to really almost sit down and talk to a mental health provider sometimes, and to think about their own sexuality and discomfort too.
Exactly. Now, do you think religion plays a factor in the health aspect of coming out?
I don't know.
Because, I feel like a lot of times, religion is the reason we are so apprehensive about talking about sex. And then now there's a Religious Freedom Act that's being mirrored down in, what was it, Indiana, they were saying that the EMTs wouldn't have to. Now, I mean, I don't know all the details to be sure, but so I don't want to speak like about that specific. I mean, I just don't even understand how you could refuse care to a patient if you took an oath as a doctor to help someone. So I think that it can play that role. So Christine, is there anything that you think I've missed that's important to talk about when you talk about health in the LGBT community?
I mean, you kind of touched on it there, and it's like, what are some of the providers thinking about too? So what does it mean to have providers who don't feel comfortable treating patients? And I think that's a big role in a lot of things that we do, is that we don't acknowledge the fact that medicine itself is conservative. It attracts some like really powerful folk, but really when you think about it, especially thinking about it in terms of how gender's on a spectrum and sexuality's on a spectrum, but medicine is all about putting somebody in, giving someone a diagnosis, essentially putting them in a box, and moving them from the sick box to the healthy box. And unfortunately, things like gender identity, sexuality cannot be easily put in those healthy, sick boxes or any box at all. And I think that's the disconnect between medicine and LGBTQ issues, is that we haven't learned how to shift that thinking from this very conservative fix it immediately model to working with people and integrating more harm reduction into healthcare generally. So I think that's something that we still need to bridge, but also making sure that the health profession is open to queer doctors. Like Stanford actually did a survey of their class, and it turns out that a third of their LGBTQ identified medical students were in the closet. And this was a survey done in like 2014. So, I mean, imagine trying to talk about sexuality to your closeted doctor.
Right, exactly. I mean, it was hard enough talking to my closeted friends, let alone a closeted professional that's in charge of my health, you know? So exactly. And I think it's interesting, you talk about, you know, taking a certain community or demographic out of the sick box, you know what I'm saying? And recently, this week, I had a guest blogger for the site who kind of talked about when you take one group out of that sick box, you're then pathologizing another community to do so. So yeah, these are all definitely important things to think about. So I appreciate it, Christine.
No problem.
Yeah. So thanks. Do you think there's any final thoughts that we missed before I wrap it up?
No, I feel like I definitely rambled enough.
No, I think you said some really great stuff, and I really appreciate it. So thank you so much. And join us next week as we discuss coming out as trans. And we'll have some wonderful guests next week. And I think you actually know some of the guests, Christine. Well, I know that you know some of the guests. And so next week, and Christina, I invite you to do this, we will be all week hashtagging my PGP and talking about our gender pronouns. And so I encourage you to go to Twitter or Facebook and tell us your gender pronoun with the hashtag myPGP. We're at Clean Closet Chicago on Twitter, and then you can find us on Clean Closets on Facebook. Thank you, Christine, once again, and have a wonderful day.
Awesome. Thank you, Jonathan.